Hi, my name's Crystal Greaves. I am 41. I live in Maryland, and I want to talk a little bit about dental health and how it's been problems for me and continues to be problems for me. Sorry, I look a mess. I'm absolutely exhausted. It's going pretty close to midnight, and I'm just not sleeping well today. So, growing up, had no problems, had my teeth cleaned, everything as a child, adolescent, and up into a teenager. At 18, I started working, no problems, except for my wisdom teeth came in, and for whatever reason, that dentist decided to take out my molars to let my wisdom teeth come in. Kind of actually did work out all except for one didn't come in. Let's see, fast forward a couple years, I got a full-time job, dental benefits, health insurance, the normal dream, right? Well, in 2002, it was July, and I was working 48 hours plus a week. It was a factory setting, and one of my coworkers was sick, and it wasn't not to be common for you to get sick while you're at work. You're working overtime, you're working 12-hour shifts. And a few days went by, and I just didn't get any better. Called my doctors, and a few tests later found out I was pregnant. That's great. However, I was only 15 days pregnant. That's how sick I was. And that continued for 9 months straight. I was diagnosed with hyperemesis gravidium. Basically, that's where you have morning sickness, morning, noon, and night all day, non-stop, for 9 months. Experienced that for a little bit. It was not fun. I had a healthy baby boy, wouldn't take that back for anything. However, after I had my son, it was recommended that I go to the dentist immediately due to the fact that I had been throwing up so much. And sure enough, I had 9 cavities and started showing some signs of dental issues then. Fast forward a little bit to 2008. January of that year, I got what I thought was going to be a regular sore throat. Didn't get better. I was on antibiotics for a couple of weeks, and long story short, I ended up going back getting another strep test done, and it came back positive. So they decided, let's keep her on antibiotics for a while. I agreed. It's strep. That's nothing uncommon. It was almost 2 months later. I had a full body rash. It looked like I had the chicken pox. Still had a horrible sore throat. Was running fevers constantly, and I got a rash. Puzzled quite a lot of doctors. I went and seen an immunologist. At that time, he really believed I had rheumatic fever and said, for the rest of your life, you're going to need to be on antibiotics. So we started down that course of treatment. I started having joint pains. The rash was actually guttate psoriasis, which is common when you have strep throat, believe it or not. A lot of people do experience that. Never before have I ever had psoriasis or any psoriatic symptoms. This had continued to go on from 2008 till 2013. And by 2013, I want to say I was on 15 different medications. By then I was in rheumatology. I had a cardiologist, an immunologist, a dermatologist, any ologist you can think of. I was been to, seen, tested, and unfortunately, tons of different medications. And like I said, at that time, I was on 15 medications. At the time, Still's disease was put on the table because I continued to run fevers for no reason at all. And that made sense. So we stuck with it and we went with it. I had been on methotrexate. If you don't know what methotrexate is, it is a chemotherapy drug. I was on biologics. Most of you probably have no idea what that is. Usually that's your classes of Humira, Kinneret, Enbrel, and Stelara. Those are the 4 that I've been on. Over all these years of being sick, taking medications, not once did any medical person tell me look for side effects that your teeth will start going bad. So in 2013, I continued on my medications and was going to the dentist, and he was noticing some problems. And due to insurance reasons, it's cheaper to pull a tooth than it is to fix a tooth. So 9 times out of 10, they would prefer to do an extraction. This went on for a while until 2017. That year, I got really sick again, and I wasn't working. I haven't been working since 2013. I left, and one of the things my dentist told me was, well, you're on disability, so you don't have too many choices. And we just can't take the time to put it into your teeth, is basically the best way it was put to me, and that I would feel better if we took out all of my fillings and put in a different kind of filling. Sounds great. Whatever. Did it. Been there, done that. Guess what? All those teeth went bad. Every single one. So then I'm left with this conundrum. I'm about ready to turn 40. I still have dental insurance, and a tooth breaks, and I go in and they tell me, you just need to have all of your teeth removed. You're going to feel so much better. We really believe this is the root cause of your problems. Now, mind you, by now, after being sick all these years, seeing doctors and doctors and doctors, I know what autoimmune diseases do. Again, it was never said anything about the medications causing these problems, but I kind of knew that taking all my teeth out was not going to be a cure-all, because by now I do actually have psoriatic arthritis. I have a rare form of psoriasis called palmar-plantar psoriasis. It's where you get pustules on your hands and your feet, and it's extremely painful. It's very weird and different kind of psoriasis. When people think of psoriasis, they think of plaque psoriasis. Like I said, this actually looks like pimples and bubbles, and it bubbles up on your skin, and then it kind of like explodes, it's a good way to say, and it dries out, and then you get that kind of psoriasis flaky look to it after you go through all that. But it continues to do it, and it spreads rapidly. So these were the things that were going on, and like I said, I was turning 40. I wholeheartedly believed my dentist that he couldn't do the work. It was going to cost too much. When I asked about implants, he said, well, basically, that's just not an option for you. So I believed him. Okay? People, I have a hard time now because I know better after the fact. So I have all of my upper teeth removed. I have stitches in, a denture put in. I hate it. It's uncomfortable. It's more pain now than what it was before with bad teeth, if that makes any sense. To top it off, I constantly have thrush, which is basically yeast in the mouth. And no matter what I do, the dentist says, it's because you're not cleaning it correctly. I take these out every night. They go into cleaner. They get scrubbed. I'm doing everything I'm supposed to be doing. I have 8 teeth left on the bottom. 8. I know it's hard to see, but they're all bad. And yeah, this denture doesn't fit after 3 realignments. After speaking with several of my doctors, especially pain management, immunology, a cardiology, I'm sorry, my dog's in the way, all agreed I was a good candidate for implants. The only reason it wasn't an option was cost. And the second reason, because I'm on disability. To be told that is crazy. Now, while I was working, and I worked a 40-hour-a-week job, I worked an office-type job, I did data entry, data analysis, statistical analysis. All that time, every time a tooth was pulled, I was offered an implant. Does that make any sense at all? To me, it doesn't. It's almost discrimination. And sadly, the insurance companies look at this the same way. This isn't cosmetic for me. This is pain. This is constant pain. And I know, like I said, it's hard to see. But those are the only teeth I have left on the bottom. I can't eat a regular sandwich. I cannot eat regular food that I used to eat, healthier foods. Now, I am just coming off of a round of steroids. I did prednisone for a little over a month, almost 2 months, due to a recent flare-up that I'm having. Still, not a reason for not being allowed to get implants. Should not be a technical write-off reason. I want you to know I'm an advocate for people with chronic pain diseases. I do advocate for that. I'm also a rep with IFAA, which is the International Foundation of Autoinflammatory with Arthritis as a factor. I know that's a lot. But being so, I have the tools to be able to reach out to legislators, and I can talk freely, and I have no problem doing public speaking. One of the reasons why I would definitely advocate that it's not just cosmetic surgery. Yes, of course, I would like to look nice. I would like to be able to go out and not worry about this when I'm talking. Nobody wants that. That's disgusting. On another reason, a personal note, I would like to be able to kiss my husband, and I can't. It hurts. It hurts for me to try to apply lipstick or chapstick and do that because it hurts too bad. It's embarrassing. Yes, that is going to fact. That's not going to change. I'm not extremely vain, but I'm vain enough that I'm embarrassed to go out in public and have people see my teeth the way that they are. I know it's not showing up as well on the camera, but hey, look at me. I'm sitting here with my hair messed up. I'm ready for bed, and I'm doing this right now. Again, I would love to be a candidate. I would be more than ecstatic to be able to have upper and bottom dentures gone and have implants. I know it's hard to fathom it, but in all reality, it is so hard to eat healthy with dentures because I can't bite into like raw vegetables that I used to love to eat. Carrots, something as simple as carrots, apples, plums, anything that you can think of. And like I said, sandwiches, I can get over it. I can cut them. Even pizza can be a pain to eat. A lot of the foods that I have to cook now are super soft. I eat tons of carbohydrates, which is horrible for my weight, of course, but they're soft. I can do the rices. I can do noodles. I get protein through beans and eggs and whatnot. It's almost impossible to eat a steak. It has to be just the right cut. It has to be extremely tender. And even then, it's a struggle for me to actually enjoy it. I'll chew for a couple minutes and it just hurts too bad because this is acrylic. This whole thing, and it's not the soft adjustable, nice kind that some people talk about having. I don't have that. And I also have the full top palate. It's extremely uncomfortable. I cannot even, unless you have a denture, then you'd understand. I hate this. I hate how I look. I hate how I talk. It makes it so hard for me to enunciate, so I have to slow down when I'm talking. But even when I do so, when I'm advocating, if I can set up a table in a hospital and we have an opioid crisis going on, but yet sit there and advocate for people that have chronic pain conditions that need these medications, I'm there in a heartbeat. And I don't care how I'm being judged about it. But I do feel like there are times that I get looked at, and I've been asked a few times, are you a recovering heroin addict because of my teeth? And that's just a kick in the gut. I'm not. I was sick. I am sick. I will continue to be sick. This is my life how it is. But to be put in that category, sometimes it's hard to hear. It really is, because people do look down upon you. A couple of my doctors have, when they looked at my teeth, when I go in, it's my first time meeting you. And when they're doing your overall checkup and they see that you take pain medication, you get treated differently. They look for track marks. They test you differently. They look at your teeth. It's crazy. These are true things. Like I said, I would love to be considered to be one of the 12 to be picked. If that happens, that would be great. I live in Western Maryland. I understand that there's going to be an office opening in Tyson's Corner, which is about 3 hours away. Be more than happy to be an advocate. Be more than happy to go to bat and talk with legislators. Anybody. I mean, I've done it before. I can continue to do it. There are going to be days that everyone's going to have a bad day and days that everyone's going to have good days, and that applies to me too. So, I will submit this and we will go from there. If you have any additional questions, feel free to ask. I'm always willing to help others that can't help themselves for whatever reason. I'm willing to go out and take that extra step, I should say, for everyone, not including just myself. Like I said, I had to learn the hard way to advocate for myself before I could advocate for others, and now I can do both. So I hope that's something that would be of interest. All right, thanks.